I'm Mary Savoie. If you're French, you pronounce that muddy Savoie, which is much prettier. I'll be 80 this year. When I was about 60, my doctor mentioned to me that cataracts, if you live long enough, become a problem. And I had lived long enough to have the beginnings of them. He didn't even talk to me about surgery. He said, they're nowhere near ready. He was saying, come back in a year. And finally, this past year, I complained bitterly that they may not be ready, but I want to see. And he sent me to Dr. Montague.
A cataract is your natural lens, which has become cataractus, which kind of means turning yellow or hazy. And when it does that, it makes it so that you can't see through it anymore. And once it's visually significant, we fix it with surgery.
My left eye was done about 12 days ahead of the right eye in a manner that is ordinary in this day and age. When I went back for the post-op visit with Dr. Montague, she broached the subject of this new technique.
This femtosecond laser was developed here in Silicon Valley at a company with its roots at Stanford. It has the ability to create laser-guided incisions, which means the surgeon doesn't have to do it manually with the blade. And it does this based on a 3D scan it does of the individual's eye. It has the ability to break up the cataract a little bit even before you get into the operating room, so it's very easy to remove it. In addition, the femtosecond laser has the ability to manage some of the patient's astigmatism, which leads to better potential visual acuity without glasses as well.
It sounded very interesting, and she had told me that this is the first time that this was being done. And I said, does that mean I'm the first? And she said, yes. And if that makes you uncomfortable, I can rearrange and schedule you for later. And I said, no, I think you will be more careful the very first time you do it than any other time in your career.
So she was the first Catalyst patient that we did here, and she was happy with both surgeries, but she recognized already at day one how much clearer she felt her vision was in the Catalyst eye than she had experienced with the first surgery.
Hey, Mutt. Muttley. Even now, I know I've had something done to my left eye. I can't even tell I've had anything done to my right eye. And yet the left eye was done 10 days, 12 days ahead of the right eye. The difference is phenomenal.
The inflammation after the surgery is much less in the patients that receive the Catalyst laser, which means faster recovery for the patient also. I think this is one of the most amazing things to come along in cataract surgery, and I think it has the potential to change cataract surgery tremendously.